It was a fine Monday morning. The hospital was functioning smoothly, with the routine patient care. All of a sudden, that scary siren sounded, the hospital's fire alarm. Our fire officer, who was stationed at the hospital's fire control room, detected the place of incident. The fire officer alerted the fire team and the engineering team to have a quick inspection at the incident place, which was the electrical panel room. The smoke was externally visible from the panel room door window. The exorbitant smoke prevented the team entering to the panel room. The hospital's engineering lead identified the magnitude of the situation and activated Code Red. The respondents received the Code Red message for a swift response. The appropriate PPE were worn by the engineering team. Meanwhile, the catastrophe had already begun. Smoke, being highly buoyant due its lower density compared to air, causes it to rise rapidly. It started to sneak through the panel room, sealing gaps and eventually into the ICU AC duct. The super added issue now is the critical care area being affected by the smoke, which entered through the ducts. Smoke which contains highly toxic gases, and especially this being a critical care unit, can lead to rapid deterioration of patient's condition. Smoke layering, poor visibility, heat transfer, suffocation and flow dynamics made the patient care near to impossible at ICU. Early detection is crucial. Our nurses identified the smoke and recognized the imminent danger. A Code Red was activated for the second time, from a different location at the same hospital. The Code Red respondents started to rush to the ICU, and meanwhile the ICU nurses started patient assessment, patient reassurance and preparation. The support staff exactly knew what they are supposed to do in such situation. Credit to our training. The fire marshal briefed the scenario to the firefighters as well as to the clinical team. A quick decision was made by the chief fire officer and the medical emergency team to initiate a complete evacuation. Rapid assessment and triage were performed by the medical emergency team. The critically ill patients were transferred as priority by ensuring a safe transfer method. The security crew ensured crowd control is maintained throughout, and this synchrony led to a seamless transfer of patients. It was a well-coordinated action plan by the clinical and the non-clinical teams for a phased evacuation. Hence we could achieve a safe and a complete evacuation within 5 minutes. The Chief of Security Services ensured that the affected area is confined. The nurses were thorough about their roles and responsibilities. Medical gas valves supplying to the impacted areas were shut off. A rapid inspection was done to check for any more casualties, and the area is marked denoting it is checked. Patient disposition was performed as per the bed availability and criticality of the patient. The clinician ensured that the continuity care is resumed at the receiving area and the patients remain stable. The medical emergency team remained at the patient care area for the continuity of care. As the medical evacuation was ongoing, there was a simultaneous combat going on at the epicenter of the disaster by the core engineering and firefighting team. Safety takes the priority. The source was identified and turned off the power supply by engineering team. Aggressive source control measures were done and the team achieved the desired result. The fire was extinguished. Smoke extractors were used to control the aftermath. A multidisciplinary discussion led to a decision of deactivating Code Red, as the situation are now in control. This is followed by a debriefing session by the safety committee. The entire event and the current status were briefed to the safety committee head and recovery plan was formulated. At the end, if it is not documented, it didn't happen.